In this lecture, I'm going to show you how calcium channel blockers are used to treat dysrhythmia. So recall that in the heart, we have, remember it's a four section structure with the atria and the ventricles. And remember we have the sinoatrial node here, and that sends a message to the sinoventricular node, and that propagates the contraction signal throughout the ventricles. So to slow the heart down, this section here introduces a delay which is crucial for making sure that the ventricles contract just after the atria. So the idea here now is to actually slow this down so that we now have a longer delay between the sinoatrial node and the ventricular node. I think I mistakenly called it a sinoventricular node, didn't I? That doesn't make sense. It's just the ventricular node. Right, so how we're going to do that? We're going to do that with calcium blockers. So you might remember that in the cardiac action potential, a lot of it is due to an influx of calcium. So if we're looking at a long stretch of fibre and the action potential is here, we're going to have calcium flowing in. That's going to spread in both directions, and that will cause a depolarization to spread in this direction. So if we were to reduce the amount of calcium coming in, then this depolarization here, this spread of depolarization, would actually be smaller. And the more we reduce it, the smaller that depolarization will get, and so it'll spread less down the fibre. So the result is you slow down the speed of the action potential moving along the fibre. And one of the best known calcium channel blockers is verapamil, or at least used in this context. And verapamil blocks L-type calcium channels. The other thing, so that's the basic take-home message. The other thing that these calcium channel blockers do is, because there's less calcium entering the cell, you also get less build-up of calcium here, and you might recall that a build-up of intracellular calcium leads to a reduction in the extrusion of sodium, and that leads to depolarization, which leads to ectopic beats. Right, so this here is one effect, is to slow down the depolarization. The second effect is to reduce ectopic beats. And the third effect is, remember that this calcium here is what's causing the excitation. So this causes contraction. And so another effect of these calcium channel blockers is to reduce the force of contraction.